Dear colleague, dear friends, it's a great pleasure to welcome you to this new EHAT podcast. As you know, EHAT is a multidisciplinary organization dedicated to improving the lives of people with hemophilia, but not only hemophilia, many other bleeding disorders, including rare and very rare bleeding disorders across Europe. And today in this podcast, we would like to share with you interesting perspectives on a very special topic. Indeed, we'll be discussing heavy menstrual bleeding and in women with very rare coagulation factor deficiency. And I think we need to recognize that this is an issue that is common, quite impactful, but still too often overlooked or or underestimated. And to do this today, I have two experts with me who prepared a very nice webinar, which is currently available on our platform. The first is Saskia Scholes. Hello, Saskia.
Hello, thank you very much for the invitation.
Thank you to you for taking part. So you are from the Netherlands, from Nijmegen. And our second expert today is Priyanka Raia, and you are from London, if I'm correct.
Yes, that's right. Thank you very much for the invite.
So I have a few questions that I would like to ask you today. And if you want to get, the full picture of this, please go on the EHAT platform. Well, first of all, let's start with some background and epidemiological data. So to set the scene, how common is heavy menstrual bleeding in these women with rare coagulation factor deficiency, and why that has been historically under-recognized, Saskia?
Yeah, I think most important is that we actually do not have much data on the prevalence of heavy menstrual bleeding in these women with very rare coagulation factor deficiencies, because these women weren't part of many clinical studies. But from the cohorts we have, I think at least 70 to 80% of women meet the criteria of heavy menstrual bleeding. And heavy menstrual bleeding can negatively impact the quality of life.
Okay, so you reviewed the available literature on this topic, and what struck you? What were the most surprising gaps or inconsistencies that you identified?
Well, of course, besides the fact there isn't much data, there is a striking delay in diagnosis. For patients with a very rare coagulation factor deficiencies, there's almost an average 12 to 15 years from the menarche till the time a diagnosis is made. So that is very big gap. And what also is important to mention that certain supportive therapies are lacking for these patients. So it's important to know that even patients with a mild factor deficiency can have a decreased iron level.
So clearly, diagnostic delay is a recurring theme, and you emphasize this in your presentation. But why do so many women experience symptoms from menarche but receive a diagnosis sometimes decades later? Why is it like this?
Yeah, I think that is because on one hand, the assessing of individual rare coagulation factor activity was not part of the routine diagnostic workup. So that leaves many women without a definite diagnosis, but also the lack of awareness that these women with heavy menstrual bleeding can have a congenital bleeding disorder. And in the previous years, many studies have been published that women with heavy menstrual bleeding can actually have an underlying congenital bleeding disorder. And another very important factor is the fact that women with very heavy menstrual bleeding disorder do have this in the whole family. So when your mother and your aunt or your niece, your sister also have heavy menstrual bleeding, it's not the first thing coming up as I have a bleeding disorder. So it's just your reference perspective in the family. That's important.
Thank you. And when we look at data, evidence available, especially from a registry, so you analyze this in depth, and what are, in your view, the key clinical messages that clinicians should take from the findings?
Well, it's very important to be aware that even a mildly reduced factor activity level can have this big health problem, and that even small supportive measures and advice can alleviate heavy menstrual bleeding. and heavy menstrual bleeding have an enormous negatively impact on the quality of life. So it's important to address this in the outward clinic.
Thank you. Well, in different podcasts, we have advertised and emphasized a lot the importance of specific tools like the BAT score, SCH BAT score, and PBAC. So, to what extent is it relevant in daily practice for this specific population?
I think it's a very nice tool, especially the specific ICH BOT item on heavy menstrual bleeding and the PBAC score to use it in your outward clinical practice, because it is validated well in women with hemophilia and von Willebrand disease. So you can assess whether the menstrual period is indeed heavy or whether it is just like an average heavy menstrual bleeding. And so subsequently, you can adjust your therapy based on the outcome of the ICH BOT item and the PBAC score.
Okay, so before moving to some more clinical illustration, I noticed that clearly fibrinogen disorders are quite prevalent among these women. So why is it like this? Why is fibrinogen deficiency so important?
Well, I think fibrin is, of course, a very important substrate for thrombin to convert it to fibrin strands. And of course, you have to have a very strong fibrin clot to stop the bleed. So even in mildly reduced fibrin, women with fibrin disorders, they don't have the ability to stop the bleed because of the very weak fibrin clots. And we indeed saw that in our RBEN study, women with just a mild hypofibrinogenemia did have heavy menstrual bleeding.
Thank you. So let's now move to you, Priyanka, because in this presentation, you shared with us very nice clinical illustration. And I have some question to ask you, especially regarding the principles that should guide the management of heavy menstrual bleeding in adolescents with severe bleeding disorders. Could you elaborate a little bit on this?
Yeah, I think with adolescents, it's really important to see how they open up to you in clinic, because it's not always easy to get them to talk about heavy menstrual bleeding. But once you get into it and they start to describe how it's impacting their quality of life, I think that's where making a good assessment is really important. So how is this affecting their ability to do their day-to-day activities? Are they able to get through school? We know that iron deficiency can lead to issues with cognition and problems in school. So we want to make sure these young girls have the best possible outcomes in their education as well. And then it's also discussing the different products available for them and what they are able to use, and ruling out other pathologies, which are quite rare in adolescents, really. So making sure that we're taking a holistic approach, and doing that, we run a multidisciplinary clinic for that.
Yeah, and if I'm correct, to help these patients, we have different treatment options, factory replacement, antifibrinolytic, hormonal therapy. So how do you balance their use, especially when patients or families could be reluctant to use hormonal treatment?
Yeah, so we practice a lot of shared decision making in the clinic between the families and the patient, and we'll bring around, all the different possibilities of treatment. If there is a good factor replacement that can be used and is available for them, then that would be something we would discuss quite early on, as well as everyone's on antifibrinolytics of some sort. So tranexamic acid tablets are used a lot in clinic. And then hormonal therapies, we would discuss between them, and also the gynecologist in clinic would give a little bit of an overview as to what's available for them. We would usually start with some sort of progesterone-only pill, and discuss the options, and also explain that if they're having ovulation bleeds or pain around ovulation, that would help with that too. And that's the only option really for that sort of bleeding. So I think it's really important to take also the cultural aspects, explain that it's not just for contraception, but will also improve the heavy menstrual bleeding.
Yeah, this is an important aspect. Another one is, yes, certainly these bleeding issues are clearly related to the blood coagulation defect, but there might be other causes like gynecological causes. And sometimes it's difficult for us to know, which patient should be looked for this for gynecological cause. So could you provide some guidance on this?
Yes, so I think with younger patients and adolescents, gynecological causes tend to be more rare. So we wouldn't be really looking for fibroids or polyps in a very young patient. But as women get older, that is something to be considerate of. So we would routinely scan our patients in clinic, do a pelvic ultrasound to rule out other causes, especially if they've tried first line of treatment, like with tranexamic acid factor replacement therapy, and they're still not improving. Then I think it is worth ruling out underlying pathology that might be more structural due to abnormalities in the uterus.
Thank you. An important aspect also is the multidisciplinary approach that we should offer to this patient. So maybe Saskia, what's your experience with multidisciplinary approach to these patients? What are the benefits that you have experienced yourself, maybe in your center?
Yeah, the major benefits of a multidisciplinary approach is that you have the most important healthcare providers in the same room with the individual patient. So you can make a holistic treatment plan based on the individual characteristic of a patient. And just like Priyanka already said, you can ask the patient about the wish for a hormonal therapy, and you could also explain why the combination with tranexamic acid would really help reducing the amount of blood loss. So you can really adjust the appropriate treatment to this specific individual need of a patient.
So we need to work together to take care of this patient. This is clear. And maybe, a last important aspect, Priyanka, that you could possibly discuss is the psychosocial one on this patient. So what did you discuss in the webinar about this?
So I think a lot of these women feel very alone. They feel like they're the only person in the world with this condition, especially if they have a very rare bleeding disorder. So making sure that they have psychological support available, I think, is important. Christina Burgess mentioned on the webinar that we ran together how she also runs some peer support groups for these women so they can meet other women who also have rare bleeding disorders and not feel so alone in their in their heavy menstrual bleeding issues and also other issues that they may have that are pregnancy related.
Thank you. Well, several aspects of this were addressed during the webinar, so please uh, go to the platform and listen to this to capture all the details. So I think that brings us to the end of this podcast. So maybe to both of you, what would be the closing or take-home message that you would like to share with our colleagues today? Maybe Priyanka, yourself first.
I'd like to share the importance of multidisciplinary working here. I think it's key for this, and also not just with medics, but also other professionals, psychologists, nurses that can also be involved in the care of these women. And making sure that we make sure the patients are feeling heard in clinic is also very important.
Yeah, very important. And Saskia, on your side,
Yeah, very true what Priyanka says. And what I would like to add is that even reduced factor activity levels can lead to heavy menstrual bleeding. And of course, what also is important is a negative impact on quality of life that heavy menstrual bleeding can have in these women.
well, thank you. Thank you for your contribution to this podcast, and I'm convinced that the audience will quickly go to the platform and listen to the entire webinar. Thank you for your time, and I wish you a great day.